enamel से dentine में आएगा, ठीक है? I'm asking you because you will tell me the answers to what I asked. So when it is in enamel and dentine, what is it called? How do you diagnose it as? Caries है, but what will you diagnose it as? It is not diagnosed as dental caries. It is called as reversible, reversible pulpitis. Okay. Now when it involves the pulp, it becomes irreversible pulpitis. So when you all are treating a patient in your clinic, the patient comes to you with pain on food lodgement, or when he is having something sweet, cold, okay, the patient will have pain. But that pain will get relieved moment you remove the stimuli. Okay, so like suppose if I am having ice cream, I have caries in my 3-6. Okay, so if I am having ice cream, I will suddenly say have sensitivity there. Okay, I will have the shooting pain. But moment I stop to have ice cream, after 1 or 2 seconds, that pain will reduce. So that is a thing, that means it is reversible pulpitis. मतलब मेरे पल्प में inflammation है, but it is moment we say pulpitis. Pulpitis word means inflammation. So moment if I say reversible pulpitis, that means जो मेरा inflammation है, it is in a condition that it can be reversible. मतलब if I remove the decayed part, I can treat it. That is reversible pulpitis. ठीक है? If I ignore it, okay? अमन बाहर क्लास में चल, वहाँ चल. Okay, पहले हाथ में ऐसे हो गया, बाहर नहीं देखना. अगर जो कम से three of you पीछे आ गए. लगा दो. Okay, so moment the infection reaches the pulp, it comes to a stage of irreversible pulpitis. That means the patient will have pain, but the pain will be sharp, shooting, throbbing pain, which will not get relieved by the removal of the stimulus. That is called as irreversible pulpitis. That means my pulp is irreversibly damaged. So in that case, I may have to perform that. The treatment that I will perform will depend upon what is the stage of my irreversible pulpitis. If I am able to preserve the little part of the tooth also, pulp, I will perform pulpotomy. If I am not able to protect any part of my pulp, I will perform pulpectomy. Okay, so pulpotomy and pulpectomy. Pulpotomy में क्या है, हम थोड़ा सा part pulp का remove करेंगे. In pulpectomy, they remove the complete pulp. Okay, so now that is reversible pulpitis, irreversible pulpitis, right? After that, if we still do not do anything, what will happen? Gradually, whole of my pulp will get necrosed. So that is called as pulpal necrosis. Fine? ठीक है, मतलब the whole of my tooth is dead. Okay? So in these conditions, the treatment that we perform is root canal therapy or non-surgical endodontic treatment. Fine? अभी तक समझ आया? So this is a quick revision of what we had studied last time. So now we are studying with diseases of periradicular tissues. That means the infection from my pulp has gone into my periradicular tissues. Now what is there in my periradicular tissues? I have my, so in the root I will have my PDL, and all around the PDL, the minor dura, my PDL, okay, and my apparent part of the foot. Are you able to see? So now these are the diseases of my periradicular area. So now when you have pulpal inflammation, okay, that causes irreversible pulpitis or pulpal necrosis. Fine? The patient did not get that treated. So now what will happen? Can I get a marker, please? Last year you were speaking. I want a marker. So now what will happen is, suppose you have your, so how does your root canal communicate to your periradicular area? Through the apical foramen. Okay. So now if there is pulpal necrosis, where will the infection go next? Into the periradicular space. Okay. So first it will cause the inflammation of my PDL. Okay. If it is not treated, it will cause the spread of the infection there also. So when it causes the inflammation inflammation of my PDL, it is called as apical periodontitis. Now periodontium है, उसका inflammation हुआ, so it is periodontitis. So when there is irreversible pulpitis or pulpal necrosis, it can be of two types. Okay, mostly initially it will start to be a symptomatic apical periodontitis. Okay, the patient symptomatic माने क्या होता है? That the patient is having some kind of symptoms. Now the symptoms that the patient will have will be pain on biting. I will explain all these in detail progressive as we move forward. Okay, so this is your symptomatic apical periodontitis. If after symptomatic apical periodontitis the patient doesn't get treated, it will move to cellulitis or acute apical abscess. Okay, so all these conditions, they are interlinked to each other. So now my symptomatic apical periodontitis can go into a condition of asymptomatic apical periodontitis. मतलब पहले symptoms थे, patient ने कुछ नहीं कराया, it becomes a chronic infection, it changes into asymptomatic apical periodontitis. Anything which is not giving symptoms to the patient, that means the infection has been of low grade and is present since a very long time, so it becomes chronic. But now we do not use the terms acute and chronic except for abscess where we will use. Otherwise it is all symptomatic and asymptomatic. So symptomatic apical periodontitis can change into asymptomatic apical periodontitis, or it can go into cellulitis or acute apical abscess. Okay. After that, in case acute asymptomatic apical periodontitis है, that can go into chronic abscess, phoenix abscess, a cyst or condensing osteitis. So these are the terminologies that you should remember. We will discuss each of them in detail now. Okay, so did you all understand? पहले irreversible pulpitis हुआ, then it moved to your necrosis. After that, necrosis causes inflammation of your periodontium. That causes your apical periodontitis. Now apical periodontitis can be of two types, symptomatic or asymptomatic. Symptomatic will go into your abscess or cellulitis, or it can change into an asymptomatic apical periodontitis. Now asymptomatic will result in chronic abscess, a radicular cyst, phoenix abscess. Phoenix abscess is very important. It's a 2-mark or a 4-mark question for you. This chapter as such is a 9-mark question. Okay, phoenix abscess, acute alveolar abscess, chronic alveolar abscess are separately 4 marks or 2 marks question for you. Condensing osteitis is a 4-mark or a 2-mark question. Okay, so please read this chapter very thoroughly. Right? So after phoenix abscess, we can have radicular cyst, which can be a true or a false cyst, or condensing osteitis. So now coming to, so this is the classification. This is given in your book. Right? So when the infection happens to you, suppose you all have, now you take here Manu. Okay? She came to me, when did you come to me in your first year? Sit down. You also sit. So when she came to me in first year, she had a lot of pain. Okay? So after that, I said that you come after a few days. Okay? I also did not do the treatment that time. Okay? So we delayed the treatment. Then her symptoms went away. So what happened? Patient को problem आया. Now the infection is there, but the infection plus severity has reduced. So it becomes a low-grade infection. So now when it's a low-grade infection, the body is trying to protect itself. The patient will not have pain. It becomes a chronic state. Then suddenly, say one day she had a lot of pain. Okay. So then we started with the treatment. Right. So when we started with the treatment, I thought we thought of placing MDA. है ना? So we placed MDA because when we started with the treatment, I removed the pulp. We removed the pulp partially. Okay, we did not completely remove the pulp because after that there was no inflammation. So we just placed MDA. After that again she had pain, but after that she has never come back. So this is from first year till now she's in final year. So you see how an acute condition changed into a chronic. Acute means when the patient has pain for the first time, and there is a very high severity of pain. When it becomes chronic, the amount of infection is still there, but it is a low-grade infection. body is able to cope up with itself. So it becomes the chronic stage. Okay? So now this classification is given by Grossman. It is given in your books. Same thing which I had told you, symptomatic periradicular diseases can be classified into your symptomatic or asymptomatic. Apical periodontitis, this can occur in both vital and non-vital teeth. So now how it happens in vital and non-vital teeth, I will explain it to you. So as we move forward, we will cover this classification. So symptomatic apical periodontitis. Okay. So now it can occur in both vital and non-vital teeth. Suppose there is a patient who comes to you in the clinic. Patient says, I had chicken last 3-4 days back and I bit on a bone. Okay. So the tooth does not have decayed. Okay. But there is a trauma because of biting on the bone. So what will happen in your periradicular area when the bone, suppose this, are you all able to see? दिख रहा है तुम लोग को? So now this is your tooth, this is your periodontium. Okay, so when in this periodontium it is there, the patient bit on something, there is inflammation here in your apical area. So that becomes symptomatic apical periodontitis. So in this particular case, if you just relieve the positive agent, the pain will go. Okay, so you can have in vital teeth symptomatic apical periodontitis as in if the patient has bitten on something hard. Fine. If the patient has a crack in the tooth, that time also you can have symptomatic apical periodontitis. Okay, so these are the. When will it happen in non-vital tooth? When the patient had infection, there is pulpal necrosis, and that infection from your root canal has spread into your apical area. That is the condition when it occurs in non-vital teeth. So you understood? So anything that causes the inflammation of your apical periodontium is called as symptomatic apical periodontitis. Understood? So now symptomatic apical periodontitis is a plain painful inflammation. It is not infection. It is inflammation. Right? Inflammation of the periodontium as a result of trauma, irritation or infection through the root canal, regardless whether the tooth or pulp is vital or non-vital, that produce symptoms that are basically pain on biting or on percussion. So you all know what is percussion? What is percussion? When you tap up, general surgery में पढ़ते हो you percuss the tissues. Okay, so when in dental, how do you percuss? With the other end of your probe or a mouth mirror, you will slightly percuss the tooth or with your finger. Okay, you gently apply pressure. Okay, so that is percussion. Right? So in that the patient will have pain. Now why is the patient having pain? Because the नीचे base है मेरे दांत का, that is inflamed. So the patient will have pain. So now when will it be occurring in vital or non-vital teeth? Vital teeth में abnormal occlusion contacts. So how many of you all have done one round of clinical posting? 4 candidate round? Okay. You all did restorations. Why do we ask you to check the high points? When you do amalgam or glass ionomer restoration, why do we always stress that you have to evaluate the high points? Occlusion. So now what will happen if you do not have a proper occlusion? जो मेरा biting है, मैंने कोई filling कराई, if I get a restoration done, and that restoration is not done properly, it's slightly high. Okay, that means I am not able to close the mouth. So I will keep trying to close my mouth. When I am not able to close my mouth, what will happen? That particular area, the apical area, will get inflamed because there is something new there, which is not letting me go back to my normal position. So abnormal occlusion contacts, high points in recently placed restorations, okay, traumatic blow to the teeth, wedging of foreign objects. Suppose you eat something gets stuck in your tooth, okay, that also causes. Sometimes your abnormal occlusion contacts can also be, suppose you have got a crown done, which is not of a proper contact or it is not in proper occlusion. That also when it continuously applies pressure will cause apical periodontitis for the patient. So now you understood what are the conditions which can cause apical periodontitis in your vital teeth. Now coming to non-vital teeth. So firstly it will be sequelae to a pulpal disease. Now sequelae when I say, so it will be a progression of what happens after your pulpal diseases. So it will be basically the pulp is non-vital, the pulp was necrosed हो गया. After that the infection spreads into your periodontium. So the first thing that symptomatic apical periodontitis. Now we have started with the treatment. When we are doing root canal, so when we do root canal, we will be doing some kind of instrumentation. Okay, so if my instrument goes beyond the tooth, that means I am going in an area where I am not supposed to go. I am going in the periodontal area, periodontium. So there if I go, if I do the instrumentation, patient will have pain, right? If there is suppose perforation of the root or over instrumentation of the root canals, all these things can result in symptomatic apical periodontitis. Now what will the patient have? Anything that happens in the tooth, patient will always have pain. Now the type of pain will help you to diagnose what the problem is. Now the patient in this condition will let us know that there will be pain and tenderness of the tooth. The moment you touch the tooth, patient will jump up करके बोलेगा patient, ठीक है? और tooth is slightly sore and sometimes the patient will come and say I am feeling मेरा दांत ऊपर आ गया है. Why is that happening? नीचे periodontium जहाँ पर है वो swollen है. So the patient will feel that my tooth is slightly extruded. So these are the symptoms with which the patient will come to you. How will you diagnose pain on percussion? Okay, you will have to do that. Fine. Then mucosa, when you palpate the area. So in general surgery जब आप करते हो, you go for visual examination, then there is palpation, percussion. यही सब चीजें पढ़ते हैं ना. Similar things are done here also. So now I have percussed my tooth, palpate. I will palpate the mucosa overlying the near the tooth. Suppose I am having pain in my 4-5. I will palpate the apical area में जो mucosa है, वहाँ पर मैं उसको palpate करूँगी, the patient will have pain. ठीक है? So this is how we will diagnose. Then the next thing will be radial